Good evening, everyone. Before I begin, I would like you to answer a simple question for me. Could you raise your hand if you ever found yourself in a situation where daydreaming served as a coping mechanism for stress or loneliness? Okay, thank you very much. So, as we can see, daydreaming in itself is perfectly normal. It can be healthy, it can be helpful, but what I want to talk about today is what happens when this innocent habit becomes something more, when it becomes disruptive to our daily functioning. Basically, what happens when the fantasy becomes more important than the real world. And that brings me to my topic, which is maladaptive daydreaming. Now, during my presentation, I would like to answer 3 questions. First one is, what is maladaptive daydreaming? Second one is, what can be done about it? How can we treat it? And lastly, when the daydreaming becomes maladaptive. So let's start with a definition by Eli Sommer, who is one of the main researchers in this area. Now, maladaptive daydreaming is an extensive fantasy activity that replaces human interaction and or interferes with academic, personal, or professional functioning. Now, what this definition gives us is a way to understand that there are 2 main components that make daydreaming maladaptive. It is the time spent daydreaming and the effect it has on a person's life. Now, there are certain risk factors that can potentially cause a person to become a maladaptive daydreamer. The first one would be childhood trauma. Now, again, it's perfectly normal for children to daydream. They make up imaginary friends or even whole worlds. But when a child grows up in an environment that is disruptive, stressful, they can start to use their own imagination as a way to escape this difficult reality. And if that pattern repeats too many times, it can lead to development of maladaptive daydreaming in adulthood. Now, the next risk factor is capacity for absorption. This basically means the ability to become engrossed in a certain task or train of thought. Everybody has a different capacity for absorption, and people with a very high capacity are at more risk for maladaptive daydreaming. Then we have addiction sensitivity. Again, some people are more prone to developing addictions than others, and maladaptive daydreaming can sometimes be considered a form of addiction to fantasizing. And lastly, we have social anxiety. People who suffer from social anxiety often deal with isolation, sadness, and loneliness. They, like everybody else, want to find satisfying relationships, but they find it difficult, sometimes even impossible. Therefore, they can turn to maladaptive daydreaming as a way to compensate this struggle that they are facing. Now, let's move on to symptoms. There are 3 main groups when it comes to symptoms of maladaptive daydreaming. First one would be yearning. This is the strong desire to engage in daydreaming as much as a person can. And it also connects to a psychological suffering that a person can experience if they are not allowed or unable to engage in their fantasies. Then we have a group of symptoms called kinesthesia. Now, those include all of the movement that a person exhibits while they are daydreaming. It can be pacing, it can be gesticulation, and it can also be acting out parts of the dialogue. So a person is speaking while they are in their fantasy. Lastly, we have impairment, which is, I believe, the easiest to observe for other people. This is the neglect of certain responsibilities, tasks, or relationships that happens when a person becomes more and more focused on their fantasies instead of the real world. Now that we've covered symptoms, let's move on. Let's imagine a person who already has maladaptive daydreaming, and let's say they try to stop. So what can be potential triggers that can cause them to engage again in this disruptive activity? We have stress, loneliness, dissatisfaction with reality, and boredom. Now, what all of those four have in common is that they are generally unpleasant. All of us, I believe, try to avoid those states if we can. So, when a person suffers from maladaptive daydreaming, their main way to deal with unpleasant emotions is daydreaming. So, it's not surprising that those four can be potential triggers. Now let's see about overlap with other disorders, because in case of this disorder, the overlap is pretty high, especially with ADHD, anxiety disorders, depression, and obsessive-compulsive disorder. Now, the exact nature of the link between those disorders and maladaptive daydreaming is not yet known. But there is a hypothesis that all of those disorders, basically all of mental illnesses cause some form of psychological suffering, be it anxiety, sadness, or other negative emotions. So it's not surprising that people who suffer from those try to find a way to escape that sad reality, and therefore can turn to daydreaming as a way to escape. Now, let's move on to diagnosis and treatment. In terms of diagnosis, it is still pretty difficult due to the fact that maladaptive daydreaming is not yet considered an official disorder. So it doesn't appear in any diagnostic manuals, and therefore it can be difficult for a person to find support they need. But there is a scale that is called MDS-16, which, as you can easily guess, stands for Maladaptive Daydreaming Scale. This scale consists of a list of questions that helps to assess how much time a person spends daydreaming and how it affects their life, their responsibilities, and their relationships. Now, when it comes to treatment, so far we know two methods that are most helpful when it comes to treating maladaptive daydreaming. First one is CBT, which stands for Cognitive Behavioral Therapy. And this therapeutic approach focuses mainly on identifying the disruptive patterns of thought and behavior, and therefore tries to work on changing them. So in case of maladaptive daydreaming, we identify the pattern, disruptive pattern that is daydreaming, and later we work on finding maybe healthier ways to cope. Secondly, we have mindfulness techniques. This includes such activities as meditation, as grounding yourself in reality, and the grounding aspect is, I believe, the most important reason why this works, because it helps a person to focus more on here and now, instead of getting lost in their own mind and imagination. And both of those treatments also help to manage stress better and to find healthier ways to deal with it. And that's why it works. Now, to summarize, what I would like you to take away from my presentation is, firstly, that not every daydreaming is maladaptive. Daydreaming is often a sign of creativity. It can give us insight into our own emotions, thoughts, goals, and maybe some needs that we are yet to fulfill. Now, the difference between maladaptive and adaptive daydreaming is the effect it has on a person's life. More specifically, in case of maladaptive daydreaming, it is the destructive and really destructive effect it has on one's responsibilities and relationships. And lastly, what I would like you to remember is the maladaptive daydreaming scale, because if you are interested in learning more about this topic or to get more insight into your own daydreaming habits, this can be really useful. It is available in many languages, including English and Polish. And there is also an online questionnaire that you can fill out, and it will give you an answer how your daydreaming is. It's not an official diagnosis, but it's something that can give you some tips what to do next. And that brings me to the end of my presentation. Thank you very much for your attention.